Oncovascular surgery is a branch of surgery and surgical oncology in particular that is concerned with the management of patients with tumors in the vicinity of major axial blood vessels. Many of these patients are considered inoperable or irresectable, and quite often that they do not get surgeries done in their line of treatment, and they only receive chemotherapy and radiation therapy, and if ever they get surgeries, they get sort of partial resections with more or less big residuals if ever they got it. Oncovascular surgery is an approach to these kind of tumors that enables excision of these tumors along with dissection of vessels, of the major vessels from the tumors, or excision of the vessels with the tumor and replacement of these vessels. So in short, these patients are more or less underserved, probably due to the fact that the current subspecialization system of medicine and surgery has put them into the periphery of 4 different disciplines. These disciplines are the surgical oncology, the vascular surgery, the reconstructive microsurgery, and the transplant surgery. Each of these disciplines have these patients at its very periphery, and only when you decide to focus on these patients and the prerequisites that is needed to manage them, that you get from these 4 disciplines what is needed, and find a universal approach to these kind of tumors that enables more or less radical excision of these kind of tumors. It's not expected that these kind of surgeries to carry a major leap in the prognosis of these kind of tumors, but a common question is what is expected in terms of the oncological outcome. What's expected is whatever is expected for their counterparts if they are to occur in areas not in the vicinity of major axial blood vessels, because when you work in this field, you see patients having tumors with different pathologies and different tumor behaviors, which we all know that it affects the prognosis of any tumor more than the anatomical location. So the anatomical location dictates the approach, and the approach actually will get the patients to have more or less radical resections, and the rest will be left to the tumor biology the same way it is for any tumor. For nearly 2 decades, we've been working in this field, and the approach is maturing, and the technical and the perioperative morbidity and mortality rates are very promising and encouraging to continue in different type of tumors. It's the intersection area between 4 disciplines: the conventional standard surgical oncology, the transplantation, the vascular surgery, and the microsurgery. So these kind of patients lie at the periphery of these 4 disciplines, and only when you focus on this central area, gathering the prerequisites from the 4 disciplines, one should be able to have sort of a universal approach that can serve patients having tumors in the vicinity of major vessels. And if one would list what sort of tumors and patients that can be served, then working from head to toe, then we can say that it can serve tumors encasing or in the vicinity of internal carotid artery or carotid artery in general. This includes, for example, the chemodectomas and skull base tumors. And as you go downwards, you get to the thoracocervical junction, and then the locally advanced mediastinal, superior mediastinal tumors, and then you go to the liver tumors, particularly tumors in the posterior segment of the liver, in the vicinity of the inferior vena cava. And then you go to the central area of the retroperitoneum, where you get the centrally located neuroblastomas and soft tissue sarcomas in general. And then you go to the extremities, in which you find the soft tissue sarcomas of the extremities and the bone sarcomas of the extremities encasing the major axial vessel.